Marguerite Eigenram. I'm just filling in. Dr. Anne-Laure Lapeyrac was supposed to be doing this talk, but unfortunately she was not able to come here because of some family emergency. So we're kind of going to wing it this afternoon, but I think it's all going to work out great. She had sent me an email a couple of days ago. Roman is on a video that we're going to be showing. It's about a 15-minute video. She is a patient that was diagnosed already very young, and she's basically sharing her life journey. And then after that, we're going to have a little question and answer with Gabriel. She was planning on doing that with Gabriel. Since he's not here, I'm going to ask the questions. He's going to give the answers. And then we're just going to go through the slides that she has supplied. Obviously, I'm not able to, give any, background or whatever, but we'll go through the slides. And then if there is any questions that are coming from the slide, then maybe the other doctors can, fill in with information that they have. So anyways, we'll start off with the video from Roman.
Hi, my name is Roman Frédéric Gay. I am 21 years old and I'm here to talk about my life living with aHUS. I've been diagnosed at 7 months old at Saint-Justin's Hospital in Quebec, so you can probably tell by my accent that I am from Quebec. And I've always been asked the question if I've lived through the experience because I've been diagnosed so young. So yes and no. I've been diagnosed very young, yes. So mostly my parents lived through a lot of traumas. My brothers too, I have two brothers that they lived through a lot of pain too because I was a big responsibility at home. My mom wasn't around a lot because she'd always stay with me at the hospital. My dad worked like crazy because he had to double the work with my brothers at home, and because they're a little bit older than me, 5 years apart. So, they were going to school, but my mom was staying with me at the hospital. So I was a big responsibility at home. So I think they endured the most of the pain and the not knowing if I would be okay, if what I had was, I would be okay to live with it my whole life. So I think they lived through the most. But there is always that feeling that I've been having from a very young age of a little weight on my shoulders of living through my situation. So I think I absorbed a lot of my parents' feelings of the situation. I became very resilient because of the situation. I never wanted anyone to feel bad for me. I never wanted anyone to be scared for me, I think. So I always would, say, okay, no, I'm not feeling any pain. I'm okay. Don't worry anyone. I'm okay. So I think I became very resilient because of the situation. When I go to the hospital, I'm still at Saint-Justin, which is a kids' hospital, but I'm still there because of my condition. They always tell me, girl, we're giving you treatments and you're not even like moving. You don't scream, you don't cry. I'm like, yeah, I've been doing this for a long time. So yeah, I think there is still that feeling of resilience, of not wanting anyone to think that I'm not okay, and there is also the fact that I have to explain myself every time. So when people ask me, oh, why do you have this, or I have to say, oh, I'm sorry, I can't today, I have treatments, they're like, oh my god, what do you have, what is it? So I have to explain the whole thing, which is kind of a lot to explain and very difficult to explain. So sometimes people think I'm lazy because I will take care of myself and, sleep a little, or, just not do as much as others. But I have to explain my whole condition, and I think it's always like taking me back to the fact that I'm not normal. I will never be normal. I haven't had I didn't have a normal childhood. I, yeah, you know, I laugh with friends that I'm a Make-A-Wish kid, or that I didn't have a childhood like everyone. And it's a part of me that I'm very proud of, but sometimes it's hard to say, oh, okay, my 3 years, my first 3 years of existence, I did it mostly at the hospital. I did it mostly in a hospital bed watching movies, and I didn't really have that normal experience. So yeah, I think apart from that, I have a I have a pretty normal life now, so I don't feel it as much as others, but like my parents do actually, but I do feel it, and it's a big weight on a child's shoulders, and it's still a big weight on me. I think that the fear of death is still present, the fear of not knowing where to go, or not knowing if something's gonna happen. It's still there. Talking about people saying I'm lazy, or I have some limitations with these conditions. I don't have a lot, because today I major in musical theater. I move a lot. I sang. I sing. I dance a lot. So I don't have a lot of limitations, but I do have some, because with a condition like this, your body is not as strong as others. You have to work harder for your body to move, for your body to function through the day. So I feel like I have more fatigues than others. They always call me the grandma, because when I go party with my friends, I'm always the first one leaving, because I need a lot of sleep. If I work the day after, I really need my beauty sleep to work. So yeah, and also with the treatments, the fatigues is not from the condition itself. It's really from the body working harder. And with the treatments, what's hard is that before I have the week before I have to take my medication, my body is so it's heavy, it's hard to do stuff, and it's sensitive. I have to work harder, because I feel like my body really, it's like screaming to have it, because it's kind of getting slow. And then when I do have my medication, it's still very slow, because it's taking it in. So it's kind of hard, because those week before / 2 days after, I'm a little sleepy. I'm a little, not dizzy, but it's just I'm more sensitive, and I cry a lot. It's almost like PMSing, I don't know. But I have to take this into consideration when I do my stuff. I'm like, okay, so this week I know I have to take my medication. Okay, so I want to do this activity, but the day before, it's gonna be tricky, because I'll be so sleepy, and I'll be I'll be tired, and I can't do the things I want during those little tricky days. So I think those are the limitations from it. But I mean, I had more limitations before. When I was younger, I'm talking 5 years old, I had to go to the hospital 3 times a week, and I had school and stuff, and I was missing school from it, and it was hard, because those treatments, I mean, going to the hospital was 20 minutes, and then I had to get the treatments, and it was an hour 30 of just sitting in bed doing nothing. At least my mom was there. She would bring my pet shops, and we would play with the other kids. And I will never talk enough about the work of the clown doctors at Saint Justine, who are honestly amazing. They would make me laugh so much. And yeah, it was hard. I was missing time. I was missing play with my friends. But today it's amazing, because I'm in clinical study, and only have to do it once a month. I do it myself. It takes 15 minutes total. I prepare my stuff. I do it. It's done. So yeah, I have way less limitations than before, and I'm just so grateful about it. Yeah. And now I can do, I can do my stuff. I could do my treatments and then go see some friends. I will be a little tired, but I can do it. But before, it would take an hour 30 minutes doing it, and more, because the girl that would come and do my treatments, she would come and she had to prepare her stuff, so I would do it after school to not miss school, but it would take sometimes, and sometimes I would do my homework during it, but so yeah, it had its perks, but yeah. And because I'm 21 years old, and I'm still at the child hospital at Saint Justin's, I have to transition soon, and that's kind of scary because I have so much information at that hospital about my condition. They know me, they know my condition, they know how I am, they know how I react to stuff. And going to a new hospital is kind of scary because, I mean, they don't know me, they don't know my information. Yes, my whole records, they will go to the new hospital, but they don't know me personally. And I've gone to the ER at adult hospitals because they wouldn't take me, at St. Justin for other reasons. And it's really not the same vibe. It really is not. I mean, St. Justin did a great job at taking care of all of us. The staff there, they are so nice and caring. I mean, if they weren't, the vibe would be way off. But they have so much care. Like I said, the clowns at the hospital, they do so much, and it's just, everything there is it's just there to make you comfortable. Whereas in adult hospitals, I had the experience where people are less, they're less caring. It's all very cold sometimes, and I think that's a scary part for me because I'm very used to being very in a great relationship with the staff at Saint Justin's. And I had the experience also of going to the ER there and them not really taking care and not really taking in consideration that I have a weird disease and that it could be very urgent for me to get care. When I had meningitis, it took a while for them to diagnose me with meningitis because they didn't have any information, and they wouldn't take me seriously. They would just go, wait, you probably have this. We don't know. Bye-bye. And so, yeah, if I had been to Saint Justin, they would have oh, okay. So you have this, you have this, you have this. Okay, we have to take this into consideration, that you may have something more urgent that we have to take care of. So I think that's the scary part of going to an adult hospital. But I have to get through it, and that's okay. And I know the staff, they do a really good job at adult hospitals. I think because there are probably more sick people, maybe. I don't know. It moves a lot faster. And because you're not a child, they think you don't need reassurance, but we still do, So, yeah. And because my parents, I was the responsibility of my parents for so long, I didn't have independence in the information about my sickness. So my mom would always be the one talking. My dad would always be the one talking every time I used to go to the hospital. So they did hold all the information for me. And now that I have to go to the hospital alone, I have to have all those informations about my disease, my condition, And for a long time, I didn't. I think it was in 2019, something like that. In 2019, I did a science fair, and I actually did it on my condition on aHUS. And it was the greatest thing that I could have ever done, because now I know so much about myself. But who knows? Today I would have had to like ask a lot of questions to my mother. She would have got she would have to come with me to the hospital because I wouldn't have all the information. So I think independence is a big thing also about transitioning from a child hospital to an adult one, because I'm not used to doing it all by myself. I always had the help from my parents, and now I don't, and it's okay. But it's a big part of growing up, and we all go through it, whether we have a condition or not. So yeah. Thank you so much to everyone. I wish I could have been there with you tonight, but I am actually at a contest in Quebec at the regional, no, provincial actually finals of Cégep en Spectacle, which is a big contest in Quebec, and I'll be presenting a number of musical theater, and I'll really think about you guys, and I hope you wish me good luck. So bye bye.
I just like to get Gabriel up here, and I'm going to just ask him a couple of questions.
So I'll just start off by introducing myself a little bit. So as Margaret said, my name is Gabriel Lalonde. I come from Quebec, so just like Romane, and I am 21 years old as well, so just like her. I was diagnosed a bit older than her. I was 7 when I was diagnosed, and when I was diagnosed, I went through plasmapheresis for about 15 days, and then I was on remission for 3 years until I got sick again. And from then, in 2014, I have been on, I was on equalizumab for 10 years, and I just recently changed to Ultomiris a year ago, in last April. So that's pretty much my story.
So, what are the mental challenges, difficulties that you experienced during this transition from going from child to adult?
Yeah. So I'll just preface by saying this is like just like Roman, my personal experience. So I can't speak on the behalf of everyone that's in the room and everyone that has this kind of disease. But I will just be saying like what I felt. So the hardest thing mentally that I faced during the transition was not knowing where I was going. So like Raman said, the fear of the unknown. So just getting to a stage of, oh my God, what is going on? Like in a year or two, I'm gonna have to like do this all by myself. Am I gonna have to do this by myself? And so many questions that popped up at the same time. Like, what was it gonna be like in adult care? Was it gonna be similar? Am I gonna be alone? Am I gonna have like support like I had in the children's hospital? So that was the biggest thing. The way I went through it was mostly telling myself, just take it step by step. Just like see how you're feeling day to day. Just go with whatever like happens, and for the future, well, when you get there, you'll know how to handle it and you'll know what to do. So just go off your experience and just go day by day, which is mostly what I did. But the biggest part was the fear of the unknown and having so many questions, and even having too many questions, so you didn't even know what to ask the doctors that you were seeing at the time. And I also did change my doctor changed around the time when I started the transition, which was kind of hard because I had somewhat built a connection with my first doctor, which had, well, I'll say it saved my life. So it wasn't easy. Definitely wasn't easy.
Were there any steps taken to assist you during the transition?
So there definitely were, I'll say, attempts, to a lack of a better term. When I was around 14, I did have like a meeting with many specialists, so like a nutritionist, a psychologist, exactly, and a nephrologist. That all happened around when I was 14, and basically the point was to kind of prepare me to when I will be left by, well, not by myself, but when I will be responsible for my own actions and my own health, and well, just introducing me to what adult care looks like. Now, the hard thing about this, well, the hardest part was that I was only 14. So at that age, you are not, well, at least in my case, I wasn't fully aware of like everything that had like to do with my condition. So everything that touched like every aspect of my life that was touched by my condition. So introducing a 14-year-old to a adult life is kind of, in my sense, well, in my experience, it didn't really make sense at that time. So I would have, in hindsight, preferred if they would have done it more like a curve. So instead of just saying, okay, at 14 you're gonna learn everything about the life of being an adult in healthcare, well, it would have been a lot better if it was more gradual and across many years, because I had the like meetings with the specialists at 14 and then nothing until I was, well, woke up and I was in adult care. So that's it. Yeah.
So then tying in the question is, what changes have you noticed since your transition to adult care?
Yeah, well, the biggest like aspect of changing to adult care opposed to pediatric care is like the lack of personal around you. So when I was in Children's in Montreal, it's a great hospital, honestly. I have nothing bad to say about that hospital. They saved my life. They made it so much easier. And I had like a great team with me. I had the head nurse was like honestly one of the nicest people I've ever met, and she helped me through so much, so many like hard times. And that kind of just went away when I mean, I'm only 21, so I did only recently change to Charlemagne, which is the adult hospital. And it kind of just faded away. Well, it didn't fade away, actually, it just completely disappeared instantly. I was left with, well, when I started at Charlemagne, I had a nephrologist, which I saw for like a year and a half, maybe. Then I switched to having her and a hematologist. And lately it's been only the hematologist that I've talked to. And when I say talk to, I talk to her like twice a year, maybe. And I have like realistically no way of contacting her. It's a very, it's hard. Uh, the the main part is that there are so many like new things that happen and that like arise when you switch to like adult care, such as like things that I didn't even know of before going to healthcare, like insurances and stuff like that, which I have no control. Well, I have control over it, but I had no idea, no knowledge of it. So having to like dive into that at 18 when I had no idea, and my parents were right there and could have just done it like it was nothing easily, and just having to always have my opinion and asking for my like approval of accepting the treatment and everything. I felt like it could have been handled a lot better, and I just hope that like it gets better with time, because I can see how a lot of people that go through my state, like what I've been through, have a hard time with it. Because I'm lucky enough to like live with my parents still, but for people that instantly like leave their family for whatever reasons and are left alone, it can be very, very hard.
And the last question, did you ever consider stopping your treatment?
Yeah, this is, I think, a question that a lot of patients, maybe all of them, have like considered at some point. And for me, the short answer is no, because, well, I saw what happened when I stopped. Well, factor H is, of course, the most prone for relapse. So there's that part, which always scares me. But also, I also did, in fact, have a relapse. So I was always like aware of it, how it could happen, how easily it could happen. And I just wanted to put that aside and just say, I'll keep the treatment and no, nothing's going to change. But the part that I find kind of not very logical in some senses is, as I said earlier, that at 14 years old, and this is in Quebec, in Ontario it's even worse, I think. In Quebec, you are legally responsible for your health, like care, at 14 years old, meaning that at 14 years old, I could have just said, I don't want the treatment anymore, and no one could ever like say anything about it, and it would have just stopped. So that is kind of crazy. And I think in Ontario, speaking, it's 12 here. So
So
just,
I could not have said, no, you're continuing.
yeah,
He was allowed to say, no, I'm stopping.
yeah. Which is, I feel like it's kind of crazy that you can accept a 14-year-old to like have full knowledge of everything that comes with stopping the treatment for the future. And it's kind of just, that's like the main point that I feel like has to be worked on. Yeah, definitely.
Anything you want to add?
No, if anyone has any questions, I'm free to, yeah,
Question.
yes.
Thank you very much. It was very impressive. Was there anything? Thank you. Was there anything in your transition from pediatric to adult care that you kind of perceived as positive?
Well, the entire part of like children's hospital helping me up to the change was like, I couldn't say like anything about it. Like, just like I said, the nurse that I had was like incredibly helpful. And I feel like the point that started to like switch to more negative was when I switched and not before I switched. So I was kind of led to a false hope of like, oh, it's going to be okay. You'll see. It's like, it's basically nothing. The switch is going to be like that. And then I happened to like have the switch happen, and it just completely faded to black. So I don't know if that has to do with like the hospital or like anything with how it's in Quebec, but just seeing how it can go from so much support in like healthcare, but for children, and just completely switching off when you get to adult care is just kind of mind-boggling, honestly. Yes.
Yeah, so I have a question, but I just, it's 2 days from election, so everyone should vote NDP. But anyway, in any event, so what interests me is, we're here today, and it's such a complicated disease, the way it works, right? And your point is well taken. Like, did you try, either as a child or now that you're an adult, did you really try to understand it? Or did you just sort of say, well, I'll listen to the doctor and I'll kind of do what the doctor says? I'm just wondering if like there was any change in your, like, in your hope to be able to direct it yourself and understand, because I think we as parents are basically listening to our doctors. So I just wondering if that changed for you.
Yeah, that's a great question. I will say that kind of leads to my point of at 14 years old, you are not like fully aware of everything that has to like, that goes into having this type of disease. So I will say that when I was like, I'd say from when I was diagnosed to about 16 or 17, I was more so like, oh, okay, this is happening. I don't know what's going on, but I'll just live with it. And at that age, like when I started like focusing more on what I want to do in the future, my life, not only like my health life, but everything. So like school and everything. That's when I started like questioning myself, like, okay, I know what I have, but do I really know what I have? And that's when I started like getting more involved and coming to conferences like this, with the help of my mother, of course. I did start like questioning doctors, questioning nurses, questioning myself, obviously. So at some point, and that ties into the 14-year-old legal thing, you do have to become somewhat like like not self-sufficient, but like taking your own decisions. But at 14 years old, I think is way too young, because at that point you don't. Yeah, exactly.
Thanks for so eloquently sharing your experience, Gabriel. My question to you is that it sounds like you had a great pediatric team. You had a
Exactly.
great relationship with your pediatric team, and I'm pretty sure your pediatric team did their very best to help prepare you for adulthood.
Yes.
But from your description, it also sounds as though you didn't feel prepared once you went
Yeah.
over to adulthood.
Yeah.
So I think this is something that maybe worries me and maybe some of my colleagues too, as in, from your perspective, was there anything else you thought that maybe we could have helped you prepare better?
That's a great question. I mean, in my case, I would say that having like the support that I had was amazing, but it wasn't like it wasn't like following certain like protocol. It was more like the goodwill of my like doctor and my nurse, the head nurse at that time, that wanted to help me. So what I would say is having like a more official way of transitioning, as I said, like more like a curve, instead of just like at 14 we introduce you to the world, we tell you, oh, you can stop your treatment, by the way, if you want, and no one can tell you anything, and just after it's 14-year-old, like at that age, just expecting the patient to be able to make the decisions by himself, is kind of what I dislike the most about the way it was done. So what I would say is make it more like a curve, exactly. So starting off slow at 14 years old is still pretty young. So maybe introducing them, but not like going into detail about like, oh, you'll have to like call your insurance to tell them that it's fine, something like that. So I would say just making it more stable throughout the like years before, and maybe also a point that I would have loved is after the transition. So like, yes, I did change from like one hospital to the other, but I could have still had support from children's. I know it's technically like I'm not a part of it, but just and just making sure that the transition was successful, and that like I have a team that can help me at any time. It would have been very helpful. Yes.
I just thought of something because your concern is so well placed about the thing. I guess technically you could, when you were 14,
Yeah.
you could give your mother back a power of attorney and she could make the decision for you. And so, like, looking at it from the perspective of the team here, the hospital sick children, they would probably feel like they wouldn't want to make that proposal, but it's actually really practical with a disease this complicated.
Yeah.
That you might, so it's just something I think it might be like a possible workaround.
Yeah, it is. But there's also the fact that like not only am I I have the decision to like the right to decide to just stop it, but everything else, like my mother was like getting calls and she couldn't talk on my behalf because I wasn't with her and I wasn't the one answering, but I had no idea like who was calling, what was like happening, and I was like 17, 18, around 18, and like I was somewhat like I did have the knowledge of what my like disease was, but I didn't have the full like grasp of everything like she does, because she helped me a lot.
It's a little bit off topic with the transition, but one of the things I loved about Sick Kids that was so cool, they have this thing called the Circle of Care, and the experts would come in and they were always talking to Cal like he was 10.
Yeah.
And it was like right to him, and often he would answer really well, you know, but it was amazing. Like they didn't, like he's at the center, and it was like, I thought it was really impressive.
Yeah.
But it's sort of the opposite of what we're talking about.
Yeah. Well, no, but I agree. Having something like that is so helpful for, honestly, a child of any age. Even when you're just about to transition, just having that extra support is just incredible.
Thank you.
It sounded like you had a pretty rough transition from childhood to adulthood. My question is now that you understand more, now that you have a lot of support gone, do you have more anxiety towards the illness, towards relapsing and stuff like that?
That's also a great question. I would say it definitely did not help. Being like left like that, it did. I would say 100%. It did arise more, like a lot more questions, because I was now realizing like things that I didn't even know were connected to my disease. Like I keep saying insurance, but like it's true. It's like you can't expect someone like from one day to the other, like from one day to another, to just know everything and just roll with it. So like the anxiety was there. I mean, at this point, like now I'm 21, I kind of understand it better, and I've been like used to it for 3 years now, so it's not as bad, and I'm pretty like confident with my status as like a patient of aHUS. But the early stages of like around 18, 19, especially for someone that age, that at that age you're going through a lot, like just in general, anyone that's 18, 19 years old is going through a lot already. So just putting that extra pressure on someone that is already like having to start making life decisions is kind of a lot.
Okay, thanks
Yeah.
for answering that.
Thank you. Any more?
Anybody else? Thank you, Gabriel,
Yes,
very
thank you.
much. Oh,
No, I'm just like, so am I to understand that at age 12, my son, like doctors would be calling my son and I can't be involved in that? Is that how it works?
Well, not necessarily calling, like the insurance thing is more like around 18, but he does like. In my case, it was the head nurse that came up to me and said, "Listen, at 14, you're now 14 years old, and in Quebec, you have the right to remain on treatment, but you also have the right to decide if you don't want it anymore. And like you're the only deciding factor. Don't let like other sources tell you like what to say." So technically, they at 12 they could tell him like if you don't want it.
But like when you said when people would call and you couldn't hit
Yeah, that
call,
was
like
more-
is this gonna happen at age 12?
No,
Oh,
it's a bit like yeah. It's for mostly for the health insurance and stuff. It's but like it is yeah.
Can I just add to that? We had unfortunately we have some exposure to that kind of bag of questions, and it's not like the parents are out, but if in a treatment decision situation, a child or an adolescent of 12 years,
14,
here,
yeah.
14 in your case, would be found to be competent to give an answer in that particular conversation, that is where where you can't override that, and that decision had to be
Yeah.
followed.
Exactly.
So it's this assessment of competency in that situation. And it is between the caregiver and the patient. So there is no expert panel kind of, of psychiatrists, psychologists, whatever, judging. This is the caregiver, the provider, the physician, and the patient.
There is a thing called a capacity and consent board, so you could challenge the decision.
You can challenge that, but in the
And consent board,
Yeah.
they could make a different decision, but
Yeah.
technically that's correct.
But I think as an example, experience is like at Sick Kids, we use the electronic health record called Epic, and you have access to MyChart. So before 12, as parents, you could apply for your child and have access to it. But at 12, there needs to be a bit of almost a power attorney kind of situation where the child consents to providing you that access.
That's it.
Thanks very much.
Thank you, everyone.
So I'll just go through the slides from Dr. Lapirac. I think we can just read it on the screen because it doesn't make sense for me to say it. So, and then we'll just go through them. And then at the end, if there's any questions, maybe some of the doctors can give some answers to that. So, would it be okay to go to the next one? Yeah. Maybe I should read it through then, at least we know. So differences between pediatric and adult care: family-centered care, less independence, more time during visits, regular active follow-up, a larger interdisciplinary team. The adult care is patient-centered care, expected in independence and autonomy. Less time during visits, more passive follow-up, smaller and less coordinated care teams. So adult care is different. They will expect to meet with you alone, ask questions about your conditions and health, expect you to know about your medications and past treatments, expect you to take responsibility for your care and treatments, ask for your opinion and ideas in planning for your care, ask for consent for treatments, ask for you to complete blood work prior to your visits, and expect you to follow up with them if you miss an appointment. Okay, so it says discuss transition policy, and then that's from 12 to 14, and then track process, and then from age to 14 to 18 is assess skills. Age 14 to 18 is develop HCT plan, including medical summary, and then transfer to adult-centered care, integration into adult practice, and then from 18 to 21, confirm transfer completion, and elicit consumer feedback. So transition policy, transition tracking and monitoring, transition readiness, transition planning, transfer and or integration into adult-centered care, and then transition completion and ongoing care with adult clinician. So how does the disease change? There's no crystal wall. Less trigger events, less meningococcal exposition. Pregnancy planning. So maybe that was something that maybe one of the doctors could maybe touch about a little bit, because there was some questions about that. I know that was touched on a little bit with, like with IVF, but even just, maybe just talk about that a little bit if you could. Genetic counseling, we talked about that already. Problem of vascular access. CRF, renal transplantation, more fatigue, and work accommodations. And I know that some of these things will probably be addressed by Dr. Teo as well in his later talk. So how does your treatment change? Medication doses and time between doses, decision of treatment discontinuation, evaluation of the risk of relapse. It's time-consuming and more perception of lack of freedom, treatment access, drug coverage, school health plan, type of medications, many more options, but difficult choices, and then prevention measures and medications. So specific transition challenges in aHUS care. It's very rare, complex, and life-threatening disease. Diagnosis can be delayed because of highly varied clinical profiles, familial impact, episodic activity or ongoing chronic illness, lifelong fatigue. Treatment options are limited, heterogeneous treatments, access and drug coverage, treatment fatigue, psychological and emotional vulnerability, medical trauma, fear of relapse, and anxiety. Then there's the minimization of non-adherence, creation of a structured transition program with a bunch of things underneath there, and then implement tailored education sessions, and then gradual introduction to the adult team. So emergency plan. What will happen if I get sick? What are some ways that I can get help and proper treatment? What are my warning signs that I might have a flare? And are there ways I can help to prevent flares of my disease? And do I know how to contact my doctors and medical team? And so thank you to Roman and Gabriel.
You suggested to comment on this pregnancy-related kind of theme. So unfortunately, Jackie's not here anymore, but obviously, for especially for young females in this kind of post-transition, early 20s, mid-20s age, possibly thinking about starting a family, that becomes a topic. Is that how does it interfere with, or how does my condition interfere with this life plan? And there's, we could do a whole session around that. Just a couple of points around that. One is pregnancy in itself is for any kidney condition, especially those glomerular diseases, a potential aggravating trigger. So we do have in Toronto the privilege that at Sunnybrook there's a colleague of ours running a clinic dedicated to that patient group, Dr. Michelle Ladunovich. She's the physician-in-chief for the medical part of the hospital, and she is a nephrologist and runs this clinic. So we refer all our young females who wish to be referred to her for this kind of set of questions. Immediately related, of course, to pregnancy and having children is inheritability of the condition, and for that that is a topic, and it's a very relevant topic, and for that we can share our knowledge, but we always refer to in a formal way to genetic counseling. So I would recommend that anybody who would find oneself in that context having questions to request a referral to genetics. And the third comment in that context is that, of course, there's a whole literature on pregnancy-related TMA, but that's its own story. So far I've spoken about pregnancy as a trigger of something, but pregnancy in itself can precipitate TMA, and there is literature that inherited complement defects can be found in such patients. So there's at least 3 themes related to that. So it's not that straightforward, but it's definitely a very important field and needs to be addressed by the right experts. And then just one wrap-up comment, Gabriel and Romain, for the presentations, which were amazing and really already by now a highlight for the day. What you did basically was just along your story to give us a talk about transition in patients with in pediatric patients with kidney conditions. You hit on all the points and also kind of pointed towards where the problems and where the solutions are. So I think the literature has come to the insight we need to start earlier. We need to do it consistently. We need to have a sending and a receiving team, and it has to be an iterative process, and it has to be probably a longer time window. So there's literature that questions whether adulthood is achieved by 21. Should it not be moved to 25, right? So the starting point, I think the literature agrees on the early teens, so 12-ish. What was on Laura's slide is probably what it is. Might be, but it should probably take longer, and it should be an iterative process so that also the landing on the other side is kind of supported. Yeah, exactly. And I think there's a lot of neurological insight as well, that this is not just a weird group of patients. This is really kind of a renal failure having an impact on neurocognitive development and the executive functions that a patient has developed or not in a timely fashion, that this kind of goes hand in hand. And so there's a correlate. This is a real need, and we need to respond to that, and we just do a bad job so far, and we really need to do better. Okay. I think, are there any other comments or questions in that?
So I have something that really helped me transition when I was going from sick kids to an adult hospital, and that's the weeks before I transitioned to an adult hospital, I was allowed to actually go visit the adult hospital
Yeah.
and meet the staff and stuff before I actually did a treatment there. And that's what helped a lot for me.
Yeah. Thanks, Justin. That's kind of what I meant with, there needs to be a sending and a receiving team, and it needs to be an iterative process that you learn how to walk on the other side. Yeah, exactly. Oh, yeah.
There were some questions on the last slide. There were some questions on the last slide, but no answers.
Can we go back to that? Oh. Yes. Yeah. So, I mean, this would have been Dr. Lapirac's talk now. I'm just trying to put myself into her shoes now, and I encourage everybody or invite anybody everybody in the audience to help. So, I think what she really, when I read this, I thought, to a good portion, this is really just a growing up slide, right? This is not specific to aHUS. This is kind of, in a way, just what the new world looks like, right? So, in a way, it is a normal. We just have to do it. Everybody has to do it in life to take that step. But specifically, I think what it really means is, be prepared to respond to those key kind of critical points. There's a crisis. What do I do? Whom do I call? How do I have time? Do I have to? What is the emergency room that I go to? Who is the doctor who knows me? And now you're asked, when you're in Emerge, kind of just give me your story. And the story is kind of 10 books long, right? That's not so easy. So I guess there is really no answer, but that's highlighting something that needs to be prepared for. Somebody said, well, Guy, you said that you appreciate that we're trying to speak to your son. What we try is to really feel out whether our patient is able to understand age appropriate, but with time more and more, to talk about the condition, right? To understand, not only voice anxieties and concerns, but also to be able to say, this is my problem, and this is the medication I'm receiving to solve this problem, right? So that's kind of probably the way to address this. I can get to help, and what are some ways to get proper treatment? I think that goes hand in hand. Do I have a team? Am I connected to the right team? Where is my support system? Warning signs, I think we can postpone that till we talk about treatment discontinuation. That comes, and that's a question in that regard, or in that context. Same in terms of the flare-ups. Please.
I just had a brief question because you mentioned just before we started talking about the slide something about neurocognitive. Are you talking about just with adolescents in general that there's sort of a neurocognitive development?
The point is really specific to patients with renal impairment, with impaired kidney function. There's strong studies to make that point, that there is a delay in terms of the development of those functions that are required to be a compliant, insightful, reliable patient.
So what are the signs of neurocognitive lack of development that we would watch for?
The opposite of what I just said. Malcompliance, I don't care. This is, I don't need to be part of this. And taking decisions that are not realistic.
That's called being a teenager.
Yeah, but that's the problem, that it's kind of close, but it's aggravated, and it's kind of neurophysiologically or pathophysiologically explainable to some degree. Yeah. And again, one goes, I think, with one, and the last one goes with the team question again. So I think what we haven't answered yet is the treatment discontinuation flare-up monitoring part, but we can do that when we talk about treatments. Does that do justice to the question? Okay.
Doctor, in the adult care, usually means you
by a nephrologist and the here. But do we need to be seen by other doctors for the other organs, or like cardiologists?
I think this is a very specific question that will depend on the the specific presentation of the individual patient. I don't think that there is a. I can make a generic statement. You need to be seen by, or the patient needs to be seen by the appropriate doctors. But what that is, I think, is a specific.
So based on the symptoms at the acute phase, then the specialists continue in the adult.
Yeah.